Is a BR3 pathology resident. Today, inshallah, I'm going to present you in a few minutes fibrous dysplasia. So, fibrous dysplasia is a developmental lesion, and by definition, it's not a tumor, so it is a developmental lesion. If we want to talk about the clinical first, usually it affects male and female at the same ratio, so the same percentage equally. Most of the patients are younger than 30 years, and it has two forms: monostotic, which means a single lesion in the patient; polystotic, which means multiple lesions in the patient. So it can affect the face, craniofacial, and sometimes comes with craniofacial deformity. It can affect the lower extremity, and especially the polystotic form, which can affect mostly the lower extremity, and patient come with fractures. And there is special deformity called Shepherd deformity. Also, the monostotic affect the mostly the ribs, and the ribs is famous for being asymptomatic. So, from the low power, we can see scattered trabeculae of bone in the background of spindle cells, which basically are fibroblasts, and some collagenized stroma here and there, and these are woven bone. Basically, this lesion is having maturation arrest. So we have two types of bone, like woven bone and lamellar bone. And basically, lamellar bone is mature bone, woven bone is immature bone. So the bone that we have here is immature bone. If we go in this power, we have all these spindle cells, and here we have these trabeculae of bone. And some say from the low power you can see, or you can imagine, C and S shape. Some say Chinese letter, although Chinese letter never look like this, but because I think people don't want to understand Chinese, but they don't understand it. So yeah, so scattered bones. Spindle cells here and there, and here we have woven bone. Sometimes we have aneurysmal bone cyst chains, and also we have two syndromes associated with this: McCooney-Albright syndrome, and if I'm correct saying it, Mazbard syndrome. So all with GNAS1 mutation. McCooney-Albright syndrome come with endocrinopathy, also with early puberty, and Mazbard syndrome comes with soft tissue myxoma. So let's back to histology. Sometimes I forget myself while explaining the clinical, but all are spindle cells, fibroblasts with collagenous, so these are collagenous stroma, and here spindle cells in between this trabeculated woven bone, and this is blood vessel. So we have hemorrhage. So again, this is C shape. It's necessarily it is not necessarily or must be C or S shape. It's just imagination. Sometimes we use our imagination to make it very simple to us. but this actually come like C shape. So C shape woven bone in between these spindle cells from low power, and this is actually a very nice spot exam case, R1 R2. So we have these tropically scattered or interrupt between these spindle cells. These are fibroblasts. Sometimes this tumor gets mineralized or mineralization. So you see some bodies, or they called it cementimous, a variant of a fibrous dysplasia, although I didn't see one before, even in the internet. And there is also a fibrocollagenous variant of fibrous dysplasia. So the background basically will be fibrocollagenous with spindle cells and these tropically of bone. Thank you very much.